All right, here we are. Aloha, everybody. It's Dr. Gupta again. This is my second official live. Yay! This is totally out of my comfort zone, and I have like 3 cameras on me right now trying to figure out how to be live on Instagram and on Facebook. But I had a patient just call me and ask me for a second opinion, and I wanted to share with you what I had to say because I think it's very relevant, and I've had this question asked of me so many times as a dentist. So her question was, I went to the dentist and I have this really old filling that was always getting food trapped in it, and it was just causing me such a headache. And now they're saying if I don't get it redone again, that I'm going to need a root canal. And she said, is it true that I'm gonna need a root canal if I don't get this done in the next few months? And I said, well, it depends on so many things. It depends on how big the cavity is, where it is, how far it is, what your sensitivity is. There's so many factors that go into whether or not somebody needs to have a root canal. And looking at a cavity, we can tell on an x-ray, is it close to the nerve? Is it far from the nerve? But we never really can predict with 100% certainty if or when it's going to reach the nerve and need a root canal or an extraction or anything else. So my advice to her was just do your normal brushing, floss like crazy every single day, floss, floss, floss. Avoid sticky foods, things like gummy bears, fruit snacks, dried fruit. All of these things are very sticky and lead to more cavities and more problems with the teeth in general. If you love coffee, if you love tea, that's okay. Try to limit if you can. But as soon as you're done drinking your coffee or your tea, try rinsing with water. Get all of those acids off of your teeth. And if you like our Aloha Bright tooth swipes, those are awesome because you just grab a little swipe, wipe it across your teeth, and you remove all of those acids and sugars and anything that could lead to more cavities and more problems with your teeth. And the other thing is, of course, avoid sugar. So if you love sugar, that's okay. Just try to limit it all to one point of the day where you're eating all of that sugar at one time, and then go brush, floss, and do your thing. But the main thing is, how do we know if this cavity is going to need further treatment? How do we know if it's going to need a root canal? I, as you all probably know, I'm a strong believer in remineralizing. And if it's in the first layer of the tooth, the enamel, you can think of it like an onion. The outer peel is the enamel, and then the inside layer is the dentin, and then inside of that is the pulp and the nerve. So if you think of that outside layer, that's where we have the best chance and best possibility of success for remineralizing the teeth. So what we want to do is use all of these remineralizing agents. My favorites are calcium and phosphate, also in the form of a nanoparticle called nanohydroxyapatite, and it's simply just calcium and phosphate, what our teeth are made of, what our bones are made of, and trying to expose our surfaces of our teeth with those minerals constantly can help remineralize the teeth. And what does that mean? It means if there's a little cavity starting, it can patch that up and harden up that surface again by adding those minerals back into the teeth. And that's the best case scenario, that we can remineralize, make that surface hard again. But if not, yes, sometimes we do need to see the dentist and look at our treatment options. But there's so many. Fluoride is another remineralizing agent. I know some people love fluoride, some people hate fluoride, some people think it's super toxic. And my view is, well, it does work, but I think nanohydroxyapatite or hydroxyapatite, calcium phosphate, is a more natural alternative to fluoride. So it's more biomimetic, meaning it's the same minerals that our body and our teeth and our bones are composed of. So I prefer always to use the most natural elements for healing the teeth, and just simple things like using that tooth swipe that we have. We have Aloha paste. There's a lot of other products on the market you can check out. I love our Aloha paste because I make sure that I don't have any fillers or additives or things that are not necessary to help the teeth. So I feel like you get the maximum effect when you have a pure formula. And that's what I've been working so hard on, is creating a very pure formula so that it's the best for my patients, my friends, and I'm so open to feedback. If any of you have tried our products and you love them or you hate them, I want to know why so I can make it better. I'm 100% dedicated to improving everything that I'm creating and everything that I'm making. And somebody asked me if I could write like an article or a book on healthy snacks for kids, and I'm gonna work on that. It's something that I've had in process for a while because there's so many things that seem like they're super healthy, like fruit snacks made from real fruit with vitamin A, C, and E. But you know what? There's nothing healthy about that. And really, when you look at fruit concentrate and you spin it down into this concentrate, it's really it can be as potent as high fructose corn syrup as far as damaging to the teeth and to the body. So I'm open to anybody's suggestions on and other topics you want to hear. That was kind of my little spiel on cavities and root canals, and we can dive way deeper into this. I know some people have asked me, should I really have a root canal? Will I have a chronic infection in my body for the rest of my life? And that's a bigger, longer topic that we can totally talk about at some point. But for right now, I think the most important message I want to leave you with is doing your normal brushing, flossing, super clean diet, lots of water. If you love tea and coffee and wine, drink some water afterwards and use a swipe and swipe off all those acids and sugars. And if you have any questions, just feel free to send me a direct message. I'm always here. I also do consultations, virtual consultations. So I look forward to hearing from all of you and building our community here. And I'll see you soon. Aloha.